So this is a very unique situation. Not only do we have a couple who have both been presidents of the Massachusetts Medical Society, you've been married, you're practicing together. Let's talk a little bit about your years in practice. When did you start in practice?
Let's see, I graduated from medical school in 1957, went in the Navy for 2 years, went into my residency in 1960, and finished the residency program and joined the staff at the Brigham and Children's Neurosurgical Service. I was there for about 2 years when I accepted the job of Chief of Neurosurgery at Newton Wellesley Hospital. At Newton Wellesley, we did not have any neurosurgical residents. So when I started there, we'd usually have the general practitioner who referred the patient, if he wanted to, the assistant. We also had some surgical residents at the hospital. When I asked them if they would like to assist, they had said, no, your cases are much too long. You know, we could be doing 5 or 6 cases in general surgery in the time it takes you to do one of your big cases. So I thought, Barbara, would you be willing to help me?
So you did your training.
At the Boston City Hospital, and then the Boston Veterans Hospital I went to.
So different places
Yeah.
for your residency.
Except the city hospital where we met.
Okay.
And then while he was being tied up so much in neurosurgery, I worked in some of the college infirmaries because we had little children at the time, our family. And then I started seeing private patients and then assisting him in the operating room. And actually, I joined the Mass Medical Society in 1958, too, when you did.
Yeah, but you joined it before me.
So mid-1960s, you're finished with your residency, and you did your residency in general surgery.
Yes,
And you did your residency in neurosurgery.
Correct.
You started your practice at Newton Wellesley, and then at this time you were also practicing with your husband.
I also was chief of surgery at Hahnemann Hospital at the time. I was at Newton Wellesley with Fran. I was at Waltham Hospital, and I was also at
Campion Center.
St. Elizabeth's Hospital.
Oh my. With how many children at this point?
We had 4 at that
At
point.
that point. And their ages were?
They started at 10, 7, 6, 4, and then I had a baby, a girl.
Wow.
After 4 boys, that was a miracle.
Yeah. So quite an intense life you were leading there.
Busy.
Yeah. And you were busy at Newton Wellesley. You were servicing several hospitals in general surgery.
Yes.
Typical cases that you would do at that time?
Actually, most of the things I did was at Hahnemann Hospital, but was working at the other hospitals. Interestingly enough, the school that I went to with the Franciscan sisters, I became the physician there. So actually, I was working in the medical service, taking care of them if they were admitted to the hospital.
Wow. And at this point, did you maintain separate offices, or were you in the same office? So right from the start, you were practicing general surgery and you were practicing neurosurgery.
Right.
You had an office that was located in...
You had a separate office at 1180 Beacon.
Yes, yeah.
And then we
Until
went
we
into
moved to
Newton Wellesley
Wellesley.
together.
Uh-huh. Okay. And then you were providing assistance to your husband in neurosurgical cases?
Yes.
And also doing some general surgical cases as well?
No, I stayed with neurosurgery.
Okay. All right. Wow.
I did work a little bit in general surgery, and what was interesting, we did do a couple of cases with our sons. One was in orthopedic surgery, but actually he helped us in our case. And then we were with the doctor who's a general surgeon, and I helped him with his case.
So what were the challenges raising a family with 5 children, both practicing medicine and surgical specialties? How'd you balance it?
We spent as much time as possible with them. When we went on trips, we went as families. And we would go to Europe, we went to the Caribbean, we went to cross country, but we always took the vacation time as a family. The other thing was we were very involved in sports. Fran was the neurosurgeon for the Harvard football team and the Boston College football team. And I was very involved in the school sports. And I think that helped our children tremendously, so that they grew up with an atmosphere that they knew that we were always there for them. And we were always there to help them and support them. And I think that was the important part of our life. They could always reach us.
And what sort of challenges, how did your practice evolve between the 60s and the 90s, 2000s?
Actually, when I was at Newton Wellesley, we used to do a lot of brain surgery. We used to do some pediatric surgery, like with children's right down the road. I'd usually take those cases into children's. One of the times that we started an operation on a 21-year-old girl who turned out to have a brain tumor at the base of the skull, where the 5th nerve comes out of the brainstem and goes into a sinus. And it was involving and interfering with her 3rd nerve, so she was having double vision because she couldn't move her eye in the right directions. We started that operation at 8 o'clock in the morning. About 2 o'clock in the morning, I think I stepped on your booty, and I said to Barbara, cautery. It didn't happen. Cautery. And she said, I can't, you're stepping on my shoe cover. And the nurses said to her, good for you. At any rate, we finished the operation 19 hours after we started.
Oh my God, yeah.
And that 21-year-old girl used to send us postcards, including one from Europe, where she said, wish you were here. Thanks again. And then she started, when she got married, she started bringing her children in. Said, will you check their fontanelle for me?
Yeah. That's nice.
Yeah, that's probably one of the most rewarding cases we've ever done. And, you know, as one of the psychiatrists that we used to have lunch with at the hospital, I said, you mean you didn't stop for food? You didn't stop to go to the toilet or anything? I said, no. He said, you know how you did that? And I said, I have no idea. He said, you didn't feel hungry? You didn't feel the urge? And I said, no. And he said, that's known as self-hypnosis. It's the reason you were able to go the whole 19 hours without taking a break, although I did have the nurses come in with some water and slip it under my mask.
Get hydrated, yeah.
From time to time.
Yeah. So over the time that you practiced, you started in the
Barbara was with me through those whole 19 hours.
mid-60s and practiced until,
We're practicing.
okay. So you've been practicing for 50 years?
Yeah,
52? Somewhere around
that
there?
time. Well,
Wow. Okay.
Yeah.
Excellent. And how has your how have the tools of medicine evolved during that time so that you could, you know, do things today you couldn't do before?
Oh, so differently. One of the things with the development of a lot of the radiological procedures, like the MRIs and the CAT scans and everything, we turned a lot of that over to the radiologists who were doing them. So we didn't have to do the carotid artery injections because they could thread a catheter up and get probably much better pictures than we were getting with the old techniques. So as those techniques improved, we back off on having to do those. Myelograms are practically unheard of nowadays because of the MRI, which gives such excellent view of the spinal canal and the spinal fluid and the spaces in the brain. You can tell white matter from gray matter, all sorts of things that were totally impossible before. So that has made a huge difference. The other thing has been the sort of isolation of the hospitals. It used to be possible to cover several hospitals in the area. But then, I don't know whether they were getting jealous of each other or what, but they started saying, you know, you're on this staff here, you can't be taking patients to this hospital there or that hospital there. So our traveling times will cut down considerably from having to, or being able to really see patients at different hospitals. So that was a major change. Then those individual hospitals started merging, becoming bigger and bigger.
So what about the pros and cons of practicing together as husband and wife and partners in medicine?
We have a great time.
Yeah.
We really do.
I couldn't come home at night and say, oh, you wouldn't believe what a day I had. She said, of course I would, I was with you.
I mean, we are so happy that our children have turned out the way they have. We have 2 doctors, another one in healthcare, another one in finance, and our daughter runs our office for us.
When she's not writing screenplays.
Wow.
She's received many awards.
So that was our success. And it's interesting that the doctors, and one married a family practitioner who's a wonderful woman, they will say, we just had a patient who you had as a patient at one point, or a colleague. One man who was our ambulance driver at City Hospital was at a lecture given by our son Sean. And he got up in the audience and said, I knew his mother and father. His father was very serious, but his mother was a lot of fun. And then he went to Sean as a patient. When he went in the hospital, he brought in all these pictures of us when we were at City Hospital, shared it with the nurses. So it's kind of fun when they see patients that we had, or friends or colleagues. It's terrific.
That's, you bring up another interesting point, which is you've got roots here. It's not just that you were practicing together, but you got your education here, you began your practice, you stayed in this community and really put down roots that have persevered over all of these years, which is its own advantage.
We were not spending much time out of this area. When I was in the Navy, I was at Guantanamo Bay 10 different times.
But now you've got this long history here and generations of patients who have seen you and children who've gone into medicine and are practicing in this area as well.
Yes.
So really an interesting situation that way. And you had, the other thing that occurs to me is you have brought up the fact that the evolution of the hospitals has led to you being a little more isolated, because before you could travel from hospital to hospital, now they're kind of forcing you to make a choice. And you had brought up the notion that there was a time when people in the various districts and everything interacted a lot, and there was a lot more exchange among the professionals within the state. And what seems to have evolved during your careers is that we've all sort of slowly slid into our silos.
It's worked out. I remember when I was president, and we had this Globe writer come to the office, and she asked to interview Fran at one point, and how about the children? Someone said, you allowed your children to be interviewed by a Globe reporter? I said, why not? So we only had the 4 boys at the time.
Yeah.
And they said to Fran, the oldest one, what do you think about your mom and dad being a doctor? And he said, I wouldn't have it any other way. And they said to Peter, the next one, what do you think? He said, my mother gets to more of my events than most mothers. The third one, Bill said, as long as she wasn't a lawyer because Dad couldn't live with her if she was a lawyer. And the fourth one, Sean, said, she could be on time more often than she is. So. And then when we ended up having our girl, Fran wore pink ties in the hospital for a week later. Everyone knew. Every floor had a picture of our daughter, Julie, as a baby.
Mm-hmm.
So it was quite a group.
Part of your family. You know,
Yes.
the staff at the hospital and everything.
Yeah.
Wow, that's excellent. What are your thoughts about practicing medicine today and compare and contrast to, let's say, mid-60s?
Well, Epic didn't exist then.
Epic is an electronic medical record.
Yes. That that I guess is working out so that the doctors who use it
Uh-huh.
are finding it is very helpful for them. Those who don't rejoice.
So the transition to electronic medical records is, to put it mildly, painful. It
Extremely
is-
so.
Yeah, it's, the software doesn't really adapt to the way you think or the way you work at this point, and hopefully that'll change.
It's different with the major groups. Partners is competing with BI Deaconess, and BI Deaconess is competing with another, the Coastal Group, and it's wherever you are. And if you go from one hospital to another, as we did in the past, now it's a different group that's handling it, not just going in there and being on the staff and applying for privileges. It's very different.
So competition has also ramped up quite a bit.
Oh,
and
very
it's,
much.
As a result, splitting doctors. And probably, what would you say regarding the say that a physician has in hospital management in the mid-60s versus today?
I'm glad you mentioned that. I had a patient that I took care of for a number of years who went in the hospital, and I went in to see the patient, and I was confronted by a hospitalist who said, you have no right to take care of him in any way. And I said, well, at least I'm visiting him, and I've taken care of him for a number of years. It's very different. You hand over your patient as soon as they get over the emergency ward, essentially, to a hospitalist who really has to start from scratch in many cases, whereas you've seen that patient for a number of years and know every single thing about their medical care. So as a result of it, I think in some ways it helps the doctors that they don't have to be on nights and weekends as much. But on the other hand, sometimes it hinders patient care.
Right. I think as the system changes, things get tried. They have pros and cons, and we're in the midst of a period of time where we're still working things out.
I mean, we used to make rounds on our patients morning, noon, and night. And I mean, it was a lot of work, but it was rewarding. But on the other hand, now having a hospitalist, you have to be in touch with them and find out how things are going. And then immediately the patient comes back to you.
Yeah, and you don't always have the information you need. Yeah, well, that's one more thing. Okay. Bob, this has been a great discussion with 2 past presidents, and I really appreciate you taking the time to talk to us today.
Well, we appreciate your time, too.
Thank you.